Good morning, guys, and welcome back to W.D.Y.D. CSP. What do you do as a central sterile processor? Guys, today on this free education, we are going through the CRCST, CS, uh, CBSPD uh, manual for certification, and we are in the chapter uh, going over regulations and standards. Now, this one is a big one, guys, because this one drives everything that we do. Everything that we do um, comes from these regulations and standards. But first, you have to understand what are regulations and what are standards, and this chapter goes into it. All right, this chapter is, and on the book, is a big one. It's not too big, but it's 15 pages long. So a lot of information in it. So we're gonna start with the introduction, which is statuses, regulations, and voluntary standards. All right. Um, you have to know what each one means because they're very significant. Okay. Um, Especially if you have to go into a court of law, knock on wood that you never have to, or if you're trying to adopt a certain practice in your facility. So a status or a statute is a written law adopted by a legislative body that governs a city, county, state, or country. All right. It's an adapted law. Okay. Adopted law. A regulation is a rule issued by administrative agencies that have the force of law. Okay. So regulations are law. Those are the big ones. Those are the must. Okay. And you'll hear these terminologies a lot thrown around: should, shall, could, would, must. Okay. When you hear the words must, there's no option there. There is no, maybe I can, maybe you have to do this. Okay. It's a must. Right. That's a law. Okay. That's a regulation. Standards are a uniform method of defining basic parameters for processes, products, services, and measurement. Standards, unless your state adopts it as a statute or a status, is not law. It's a volunteer. It's a guideline. Okay. You got regulatory standards. Those are the ones that are the big ones as well. They're a comparison benchmark that is mandated by a governing agency. Non-compliance with regulatory standards may lead to citations and legal penalties. Okay. Um, they put both words together: regulations and standard. Regulatory standards are standards that are big ones that are issued by governing bodies, or they are put in by your, I guess, mandating powers to be that have to be followed within the facility. Okay? Then you have best practices and voluntary standards and things of that nature. Um, Regulatory agencies, you want to know what the regulatory agencies are within your facility or your state. Okay? The big one, FDA. Okay? Um, the FDA is the Food and Drug Administrative, the U.S. Food and Drug Administration. All right. They are in charge of medical device classifications. Okay. They're the ones that regulate the medical devices, and they give them um, a class rating between 1 and 3 that makes it from low risk, 1 being a low risk and 3 being a high risk. Okay. Um, so class 2 devices would be like our sterilizers and things of that nature. Sterilization equipment, biological indicators, those are class 2 devices. Class 1, um, these items are subject to general controls, which include registration, device listings, and it says here that most Class 1 devices are exempt from pre-marketed notification approval, 501ks. We'll go into a little bit deeper details later on when we'll start talking about the devices then. There's a lot of loopholes in that. I'm not too um, there's a movie called The Bleeding Edge that would describe this a little bit better and kind of shed some light on that. So shout out to that movie. um, Again, like I said, class two devices is more in tune than what we do in central sterile processing. Our sterilizers, our biological indicators, our chemical indicators, those are all categorized as class two medical devices. Um, Class 3 devices are the most stringent regulatory devices. Those are like pacemakers and things of that nature. Those are the ones that really are up there, that really need stringent testing to put out in the market. Um, it does talk a little bit about pre and post market requirements here with the FDA. And it says unless a device is listed as exempt from regulations, a 510 submission is required for class 1. Okay, and I did say 501k, and it is 501k, but 510 submission requirement are discussed in the next chapter. So is two of them. Okay. Um, from class 1 devices. Okay, submission is required for class 1 and 2 devices. A class 3 device may require either 510 or a PMA. PMA is required for most class 3 devices. Now, I'm not sure what PMA stands for. Let me see if I see that, what it stands for in here. Class 3 devices we really don't work with too much. We sterilize them or we process them, but we don't have that our hands in it as deep as class 2 medical devices. Okay, so I can't find what it means real quick, but that's okay. Um, but a 510 in a nutshell allows you to um, bring out a product that's similar to a product in the past, and market it and present it to the FDA for approval. So it's almost like me uh, kind of copying a spoon. Okay, a spoon's been out forever, and I make a switchblade spoon. That's pretty much the same thing and does the same function. I may require a five. It may require a 510 approval application for me to get that device out in the market. It mimics a spoon. It just has a different design. So it doesn't have to go as stringent testing to put that out in the market. That's basically what that 510 is. Says the FDA regulation helps to ensure medical devices are safe for patients and healthcare workers. So they do have their little guidelines for it. You have within the acts, okay, of the FDA, you have the medical device reporting requirements. It's the Safe Medical Device Act of 1990. It requires healthcare facilities to report medical device malfunctions to the FDA. Um, they have, and under within that, you have the FDA Medwatch program, which is designed for voluntary reporting of device related problems. Okay, you can anonymously send in reports that you feel or have seen that causes harm to the patient or is a safety concern. The FDA does have that MedWatch program that allows reporting of devices that they can come out and survey the facility to see if there's any validity to the issues. Um, Medical device recalls always happen. There's three categories for FDA recalls. There's a class one, which is the high risk. Now, this is where it gets a little confusing sometimes, and I wouldn't dwell too deep into this, but it's important to know it. Okay, you have the classification of medical devices, which is class one, two, and three. One being the lowest, three being the high risk. But when you do a recall, it's opposite. Class one is a high risk, okay, and class three is a low risk, okay. So class one is everything has to be recalled. It's immediate. It's a danger to life. Class 2 is a less risk. It's a possibility that it'll cause temporary or medical reversible adverse health problems. And class 3 is a low risk. It's is not likely to cause adverse health consequences, but they want to be on the safe side. All right. Um, FDA does have labeling documentation for their medical devices, and they do regulate. They do um, uh, uh, require that all medical devices have an IFU. Now, this IFU, you better implant that in your head. Everyone should know what an IFU, instruction for use. Every medical device should have an IFU, and this is regulated by the FDA. Okay, the FDA has expressed concern about the potential for the transmission of infection disease caused by improper reprocessing of medical devices. Okay, the FDA released a document labeling reusable medical devices for reprocessing in healthcare facility. Okay, it's a guidance. Um, the document provides guidance for FDA reviewers for who evaluate pre-market approval applications for medical devices. All right. The FDA places the responsibility for safe and effective reprocessing of medical data with both the manufacturer and the user. Even though they require it, it is up to the manufacturers and the central processing technician of the facility that uses that medical device to follow those rules. Okay, so it's placed on us. Okay, if we're not following and something happens to the patient, the FDA says, look, we gave you the guidance. You guys are not following it, okay? And it's important that you follow the IFUs. On the real to real, are we always following it? No. The answer is no. I'm not going to sugarcoat it. It's no. We don't. All right. And we'll get into that in another topic. All right. So, what's the manufacturer's responsibility? Okay. They're supporting the claims for reuse with adequate labeling and ensuring the labeling has sufficient instructions on how to prepare the device for the next patient. They validate it, okay, with documentations of tests which shows that the instructions are adequate and can be reasonably executed by the users, okay? The user's responsibility is confirming that they have the facility and equipment to execute the instructions. This is a big one, guys, all right? I remember, I can tell you a quick little story. I remember a time that I was working at a facility and they introduced a medical device to us. And I grabbed I asked for the IFUs, and I'm reading the IFUs. And it was something that we don't practice or couldn't practice in our facility. There was no other option. But when they presented the package to us, they presented it as completely different. So when I questioned it, they looked at the IFU and said, "Oh, wait a minute. Um, let's look into this a little bit deeper." Um, Make sure, guys, when a medical device is presented to you or you're not familiar with it, read those IFUs and see if you can perform the cleaning practice or the reprocessing practice of that medical device. Because a lot of times, the vendors, I'm not putting them out there, but people put out their product and be like, oh yeah, it's great, you can use it, blah blah blah, but they don't know the layout of your facility. They don't know how you're working your facility. They don't know even the equipment that you have in there. And they might have validated their equipment to be ran on a specific cycle or a specific machine, with a specific chemical, and you don't have that. Okay, and they don't give you no options on it because they just focus on that. Now you have to go back to the manufacturer and be like, look, we need other documentation stating that we can do this. So that's a big one. Okay, IFUs, guys, very important to follow them. Also, the responsibility of the user is the verification of manufacturer's instruction, ensuring the instructions are followed. Okay, how do you verify it? What is the verification process? We'll go into that a little bit deeper later because there's a chapter here on verifying and verification. But you have to be able to mimic the same instructions that they gave you. You must be able to do it. Okay. They say this is a major step towards providing healthcare professions with manufacturers reprocessing IFUs, which are a necessary resource that have often been difficult to obtain. In the past, they weren't. They were very nonchalant, very plain. They're a little bit more complex and still needs a lot of fine tuning. Um, I did a video a couple months back reading through an IFU and demonstrating, and some of them are very complex, guys. Um, FDA enforcement is a big chapter on FDA because the FDA is the big bread and butter with regulatory. All right. You also have the CDC, which is another regulatory agency. Now, it's a federal agency within the Department of Health and Human Services. Okay, so Health and Human Services, and then it's within the CDC. Um, the CDC is the Center of Disease Control. Okay, they provide documentations on our PPEs and give us guidelines for disinfection and sterilization in healthcare facilities. It also gives us guidelines on how to put on and take off our PPEs, which is our personal protective equipment, goggles, face shields, gowns, gloves, things of that nature. You also have the U.S. Department of Transportation, which is the DOT. They're also a regulatory agency. All right, they tell you how you should be transporting and labeling biohazardous materials within the facility and out and into the facilities. Okay, this is a big one going forward with a lot of off-site reprocessing facilities, or if you're transferring medical devices within facilities between facilities. Um, you have the EPA, okay, the Environmental Protection Agency. Okay, they are ones that are responsible for minimizing greenhouse gases, toxic emissions, regulating the reuse of solid waste, controlling indoor air pollution, and pesticides and things of that nature. Greenhouse gases is any of the gases that absorb solar radiation, are responsible for the greenhouse effect, heating of the ozone, and things of that nature, including carbon dioxide, methane, ozone, and fluorocarbons. So, if you have ozone sterilizers, the EPA controls that. All right. Um, Also, the EPA regulates our chemicals. All of our chemicals that we use should have an EPA number on there. Um, they have an act called FIFRA, okay, which is the Federal Insecticide, Fungicidal, and Roticidal Act, and the 1990 Clean, that's within the 1990 Clean Air Act amendments. All right, they regulate uh, disinfectants, sanitizers, ethylene oxide if you do ETO, et cetera, et cetera. Okay. Um, all EPA approved products um, must contain the following label information, okay, which is product ingredients, directions for use, IFUs, product precautions and warnings, that's in the safety data sheets, directions for storage and disposal, which is also in the safety data sheet, an EPA registration number, and an expiration date if applicable. If you're looking at your dish detergents and things of that nature, um, there is instructions on there. And if this has an EPA number on it, I'm not sure with this one here. I'm not going to put it on there because I don't promote this product. But there is a number on it. It'll have an EPA document number. It'll say EPA and then a number on there. You can actually go on their website and see if your product is EPA approved. Many of our disinfectants that we use in the healthcare facility and all the chemicals that we use there are EPA registered. Should be, but they should be um, EPA registered. Excuse me, guys. Um, OSHA, another lot of regulatory agencies, guys, a lot of regulations. OSHA, okay, that's the Occupational Safety and Health Administration. They're for the workers. They protect us. Okay, they're the ones that go in and say, hey, um, you know, you're working around chemicals and things of that nature, the exposure limit's too high, or the concentrations are too high. These are the ones that set our limits as to what we can limit ourselves to get our exposures to. Um, they're for the patient, they're for the employee actually. All right. They let you know how long you can stay in unsafe work conditions and things of that nature. They have all those good things going on. All right. Then you have other regulatory agencies uh, such as CMS. Okay, that's the Center for Medicare and Medicaid. They're the ones basically that pay the hospitals. They pay the bills. That's the ones with that. That's where the money comes in at. Um, CMS is important to CS technicians because the agency performs both announced and unannounced surveys of the hospitals, long-term care facilities, surgery centers, and laboratories. Okay, failing to follow, this is big, failing to follow CMS standards, okay, not regulations, standards, this is their guidelines, may result in the loss of all federal funding to the facility. That's a big one there, guys. All right, really big. Okay, we move on to state regulatory agencies. Okay, specific states have their own regulatory agencies. The Department of Health, the Department of Transportation, EPA, OSHA, that's within the state itself. So it changes from state to state. Then you have professional associations, which help us with our standards. Okay, the big one for sterile processing, and this is the big dog, is Amy ANSI. Okay, the Associations for the Advancement of Medical Instrumentation, and then you have ANSI, which is the association. ANSI is the American National Standards Institution. All right, but Amy gives us our guidelines for steam sterilization, the processing of endoscopes. They have a lot of standards. They also have a lot of technical information reports. But the big one for us, they call it our biggest guideline, which is ST79. Um, it's a the comprehensive guide to steam sterilization and sterility assurance in healthcare facilities. This is where a lot of our practices with how we wrap, how we store, how we sterilize, how we unload, space requirement, flow of processes, things of that nature. That's a really big one. That's that I can do videos over videos over videos on Amy. But that's the big one for us. Certain states have adapted Amy standards as regulatory standards, as law. Um, I was trying to find which states do. I know New Jersey is definitely. I'm not sure of any other states that adopted Amy standards as law. I haven't been able to find a list of that. I'll still look for that and I'll comment on that later on. Okay. I already mentioned ANSI. You also have AORN, which is the Associations of Perioperative Registered Nursing. Remember, CPD started as a nursing profession. Okay, it was a nursing function. All right, and then it branched off. But they have guidelines for CPD that usually are in line with AMI standards. Sometimes they butt heads a little bit, or one states something and the other one doesn't. And again, it depends on what your facility follows. So CPD will always say, hey, the AMI standards, blah, blah, blah. And then the nursing facility or the OR unit say what AORN says. And that's where some conflicts can happen, but they're usually pretty right there head in head. So you also have APIC. APIC is basically the Associations of Professionals in Infection Control and Epidemiology. Okay, those are infection control specialists. All right, there's a special certification for that as well. There are infection control specialists. They have their hands in everything in the hospital. They collaborate with CPD to make sure that we are not cross contaminating, and that we are processing instrumentations to promote patient safety. Um, you also have the International Standards Association, which is ISO. ISO is usually more for um, the European countries. They do a lot of ISO, but we do have ISO standards that coincide with AMI. A lot of the AMI standards are coming from ISOs. You have the Joint Commission. Okay, the Joint Commission is more of a voluntary surveying group. Okay, they're a organization, nonprofit, usually a group of healthcare professionals and subject matter experts that help guide the hospitals and give us some of our best practices and things of that nature. All right. They say here that CS technicians must understand and cooperate with the facility's procedures to comply with the Joint Commission. Um, they must know and promote the hospital's mission, and we have to know what we're doing. We have to be able to speak to our processes when they appear. So if two technicians are telling two different processes, that's going to raise a red flag. You have the National Fire Protection Association. Of course, you have to be in fire regulations even in your home. Um, and you have many other. You have the excuse me, guys, World Health Organization, WHO. All right, they're basically all the United Nations and all the countries in the world together to make sure that no outbreaks happen. They were the big ones who had our hands in the COVID pandemic to basically throw it out. When AIDS hit, when all those big diseases hit, it's who that's first on the scene to make sure that everything is under control, and they initiate acts to keep it under control. Then you have other regulatory agencies, not regulatory, I'm sorry, other standards or other volunteer associations that help guide us. You have the SGNA, they're the Society of Gastroenterology Nurses and Associates that deal with basic flexible scopes and basically any gastroenterology procedures. Um, they give us guidelines for flexible scopes, um, high level disinfection and processing the scopes. You have the Canadian standards, you have the European Committee. But in conclusion, a lot of guidelines, a lot of standards, a lot of regulations. Guys, it's important that we know these, okay? This isn't something that we just look over and go, eh. Um, we don't have to worry too much about that. We don't have to read into it. It's important that you know, especially our standards. The FDA stuff it's important to know that we have medical classifications, and when items come in that they are classified correctly. We just can't use anything. We just can't sterilize anything. It has to be an approved medical instrumentation, and then it has to have IFUs. All that is regulated by the FDA. Our sterilizers, how they function, the parameters, things of that nature, our chemicals, the EPA. But AMI standard helps us understand all that. Okay, our AMI standards, AORN standards, all those standards help us understand all those regulations and our standard and our rules, best practices, and things of that nature. It's a really, really in tune chapter. I recommend that you read it. Be very familiar with it. Be familiar with the acronyms, okay? FDA, WHO, EPA, ANSRI, AMI, a lot of acronyms. Be familiar with them. Those are the big ones right there. TJC, the Joint Commission, CSM. Those are the acronyms are really important, but understand what part do they take in the role of central sterile processing. Okay, how do they affect our everyday flow and what we do in our department? Again, this channel is called W.D.Y.D. What do you do? Okay, it's not about what you do, and it's why you do it as well. Okay, Why do we, sterilize as such and such? Because the FDA says. Or why do we only use 1 ounce of chemical per gallon? Because the EPA says and OSHA says. Okay, why do we have to wear our PPEs? Because OSHA says again. What do you do, guys? Okay, who guides us? It's not like these rules are just made up. And don't get me wrong, the hospitals have their own regulatory, their own standards and their own practices. All right, because we can look at standards, and standards are unless it's adapted by law. Unless it's adopted by law, standards are they're voluntary. Okay, you don't have to follow them, but you should follow them. Okay, and you'll see that in a lot of in the standards writing. Should do this, could do this. The facility may do this. All right, a lot of that. There's rarely any must unless the FDA or regulatory agency throws it in there. Okay, just like PPEs, you'll see must don or must doff or must, utilize. Okay, EPA with the chemicals must. You'll see those words in there. But most of the standards that we follow are we can interpret it in different ways, and the facility can do a risk assessment to see if that, because not every facility, I'm gonna say this, not every facility can run the same. Okay, if you're going from a large facility to a small facility, if you have a lot of room or you don't have a lot of room, you can tweak the standards for your facility, and the facility may determine, hey, this is a best practice, but this is something that we can't do because I'll take this for I'll use this as an example, and I'll demonstrate this later. But one of the best practices when in decon, when sorting through instrumentation, is to open the instrumentations fully and stand them up butterflied, okay, so that they stand up and get maximum. If you have a large enough washer that you can do that, that is the best practice. But if your facility has a small washer with low racking and those instruments are going to hit against the arm, then you can't adapt that. So you have to modify it and say, hey, I can't stand them up straight up, but I can lay them down flat, or I can just open them up and commingle them in the tray, and that's acceptable as well. So, guys, thank you for joining me. This was Chapter 5, Regulations and Standards. Understand the difference. Regulations are law, standards are voluntary unless adopted. I keep saying adopted into law. All right. As always, guys, thank y'all for watching. Hit the subscribe button. Give me a thumbs up. Comment down below to see if I hit or missed anything, or I might have overstated a couple items or made them a little bit more complex than what it is. As always, guys, thank you for watching. See you next time when we go into Chapter 6, which is infection prevention, guys. And that's a big one too. And we might commingle that one or lead right into decontamination, which is the following chapter after that, which is also, they kind of go hand in hand. All right, guys, peace.